traveling around, Robert, and working with all the other clinics, you must hear some wonderful stories about how patients, how their lives have changed, and I bet you hear some heartwarming, you know, anecdotes.
No, yeah, there's a lot, and I think I mean there are several, and if you go back to the beginning of the work by Brodemeier, was that they really focused on patients that had a situation in life, and we don't think about it. But if you're a singer, if you're actually playing certain instruments like saxophone, you can't do that if you're dentures. It's impossible.
Yes.
If you're an opera singer, it's not a good thing if the dentures are. So I mean, there's a lot of stories about patients that changed their lives from being sitting in their apartments and being really outgoing personalities. People that based on the change of their dental situation, changed their lives. And I think coming back again, what you said earlier about the social stigma is something we are underestimating a lot, because we don't have that. We don't know what it really is. You said that earlier as well. We don't know what it is.
Yes.
There's a lot of stories about this, and I think it's something that should be communicated more than what we do. There's a lot of stories.
Yeah.
So, and I think
there's a common theme. There is a common theme.
It's in every country. It's in every situation. It's in every demographics. It is the same. So I think in some way I've been working with implants for a long time, and I think all of us that has been, or many of us that are involved, we feel in some way that we are in a business, we are in a profession, but at the same time we do a good thing for humanity, because it is good. I'm absolutely convinced. I would not have been personally spending my life on this if I didn't think it was a good thing for patients to have this treatment, because it is really truly changing people's lives.
Well, we're very fortunate, Robert, that you have dedicated your time to pushing this and pulling all this collective group of people together. And again, we're very honoured to be a part of that. Yeah. I have one funny little anecdote with a patient. Again, a common theme. Yeah. A couple came to me years ago, and the wife needed the treatment. You could just tell she was feeling at a low ebb. She came in just as our normal patients come in. They were very self-conscious, social stigma. Obviously her teeth were an embarrassment for her. She couldn't eat and chew the type of food that she wanted to eat. She had probably mentally at a low part of her life. You could tell she was very dishevelled. She wasn't really looking after maybe other things as well. Her hair was all and not wearing any makeup, and just not dressed maybe the way a very attractive looking woman, but not dressed maybe the way she would want to be. Very shy, reserved. And of course, we were very privileged that she'd come to us to have the treatment, and we reassured her, we listened to all her needs, and we provided the treatment. And lo and behold, a few months later, she came out the other end of the journey, and wow, what a change in transformation it was. Like we see with all our cases, it's like a new person. It's incredible. It's like a new person. So, coming back for the reviews. Which are enjoyable visits for our patients, because it's easy. It's a catch up. It's some feedback from both sides, some coaching again, some hygiene, and you could just tell that the personality, the expressions, the smile from the eyes. You can tell when somebody's super happy. They're not trying to cover their mouth. She'd been on numerous holidays, etc., etc. And we were patting ourselves in the back, thinking, this is another wonderful journey for one of our patients. And then a few months later, I got a phone call to the clinic. Lo and behold, the husband came onto the phone with a very stern voice. "Dr. Lutton, I need to have a word with you. What have you done? What have you done to my wife?" And I was thinking, oh no, goodness, what's happened here? Maybe something's gone wrong. Yeah. We're here, we come back up, something's gone wrong. It's unheard of. What could go wrong? And he said, I never see her anymore. She's always out with socialising with her friends. She's away on holidays. She's a different woman, but she doesn't seem to want to know me anymore. So that's the flip side to all this. You've got to be careful.
No, it's true. I would just give. I think that is. I mean that could happen.
That could happen.
But this is also something that happened in long time ago. The first patient's name was Gösta Larsson in Gothenburg in 1965, and the second patient was Sven Johansson. And the second patient was actually attracted to the treatment because he was a cab driver.
Okay.
And after he was picking up Gösta Larsson at Professor Bornemark's clinic and drove him to the railway station. And this Gösta was chatting all the time how good this has changed his life. So Sven Johansson dropped off Gösta Larsson at the railway station, and then he drove back to the clinic.
Okay.
And went into the clinic and said, I really don't know what this person had done, had got, but whatever it was, I would like it too.
Yeah, okay, very good.
There you go. That was like the start of the journey. So I think it is, and the enthusiasm of patients as well.
There's nothing like a patient recommendation.
Oh, it's true.
And I think it's one of the things that, again, we've tried to nurture at New Life Teeth. We have set up an app that communicates, that as a communication app for our patients.
Fantastic.
Prior to them having treatment. So if a patient feels they need this type of treatment, we advertise obviously the benefits of what we offer, and if they feel that they qualify for that, or they feel like it's something suitable for them, they come through our teams. We listen to their needs, we listen to their wants, their desires, and we get a lot of information from the patient. And then if they are suitable, which again most patients are, even before they come for their consultation, we provide them with a communication tool, an app that's a community of patients that have had this treatment. Over the years, and wow, it is so powerful. I cannot believe how powerful this is, and when you break it down and think about it, it makes sense. Because you can actually talk to somebody who has just gone through the journey. You can talk to somebody who has come out the other end, and we always feel like it's a stupid question. I think it's human nature. You feel maybe I shouldn't ask that. It's maybe a silly question to ask, and why I should know this. But we all have these questions, and they're all for us. They're very important questions. It could be do the sutures come out after the treatment? Do the stitches come out after the treatment? What type of food can I eat? What type of how much time would you recommend we take off work? And do I get to choose the colour of the teeth? Am I allowed to choose these little details? And this communication app is wonderful for that, because everybody has come through this journey, and everybody has these questions, and everybody finds the answer to the questions, and it's been a big thing for us at New Life Teeth, and very important. And I would recommend it for other clinics that are doing this type of treatment. It's certainly it's been revolutionary for us. On how that patient can get very quickly to the answer they're seeking, and be reassured. So that's one of the things that's been very good. But word of mouth is very good as well. Like your taxi driver, the word of mouth. That's the best recommendation.
Yeah, but this is excellent to have that, because I mean you always know that usually in the practice the real question comes when the clinician is leaving the room and the patient asks the assistant, correct? That's right. So I mean now you have it also to the patient. Previous patients, which is even one step better. It's very good. You do a lot of things. You do everything right at New Life Teeth.
Well,
you have great success.
We're always trying to make it better. And again, with being part of this, this is another spoke to the wheel. I feel, we're not trying to reinvent the wheel, but we're adding spokes to that wheel to make things better for everybody. But there we are. Good.